I spent 10 years previous to coming to Circle working for the NHS, and really the difference with Circle is it's easier.
Basically, the clinical leads are highly involved in any decision making, and these decisions are centred on common sense, clinical common sense, at what would be best for the patients.
So if we think that something needs to be improved in terms of patient care or to respond to something a patient has said, we don't have to go through numerous committees to make that happen. We are told just to get on and get it done.
The operating system and the partnership days are really about the engagement of those people who are almost uncertainly going to be bringing about whatever change it is.
Now, these changes and the way we work are reflected on our quality quartet, and this is an interactive dashboard that we've evolved here in the treatment centre. And it's also a great way of coaching the staff to bring them along in the Circle way of operating.
And the thing is, at the end of the day, it always improves it for the patient, which is brilliant.
And that's very important. That's so different to anything I've experienced before.
One of the things that they do to try and record patients' interests and views is by giving them patient feedback cards.
So if there are any issues that the nurses raise with regard to patient management or that patient feedback has raised, we adjust that as quickly as we can so that it gets patient priority.
The company has invested in us, the clinicians and the nursing staff and the admin staff, to give us all the skills we need to actually kind of improve our ability to care for patients. And that's what we've experienced at board level.
For myself, I take the opportunity as a nurse to speak openly and actively at every meeting, because I feel it's a good opportunity to say how it's working actually in the clinical area.
It really does allow the guys on the front line, the nurses, the doctors, the cleaners, who know how to make things better, it gives them the power and the responsibility to make things better for patient care.
We have the credo, the Circle credo, and I think it is exactly what it says on the tin. The patients are at the centre of everything.
It's a brilliant system. It really works.
The reward for me is when my patients say that the experience for them has been a great one.
And that's something we really would relish as a team, is we want the opportunity to make it even better for the patients in Nottingham. That's what's unique about Circle.